Hello, welcome back to my channel. My name is Neat Physio and today is part 2 of our Managing Breathlessness series. And today we're going to cover what we do with acute breathlessness. So in the moment we're feeling breathless, whether it's linked to anxiety or increased exertion, how do we actually get our heart rate and our breathing under control? But before we jump into that, just a quick disclaimer, everyone has their own medical history, social history, physical abilities or limitations. So it's really important you always seek medical advice to understand why you're struggling with breathlessness. And if you're in the moment suddenly getting a new breathlessness, it's always better to get medical advice because it could be something that is serious. So if you're unsure, speak with your GP. And if it is a sudden moment, out of the blue, you need to be looking at 111 or 999 just to make sure that it isn't something that is serious that needs immediate medical attention. So in our last episode, we talked about why we get breathless and what actually happens in our body. And that's really helpful just to help us understand why we feel what we feel. But today it's actually what do we do in that moment. And I'm going to go through a couple of key different strategies to help you regain your breath control. So the first thing to do when we feel breathless is to find somewhere safe. When we're doing certain activities where our breathlessness starts to get out of control, what we don't want is for you to start to feel faint or even fall over. So it's finding a safe position. And this is either finding an object to stabilize on or finding a way to bend yourself forwards. When we bend ourselves forwards, what this is doing is it's opening up the airways to the upper part of our lungs, but it's also enabling some of the major muscle groups to relax a little bit so that there's less reliance on oxygen, which means we can use that oxygen and blood flow a bit more sparingly in a moment of crisis. So, for example, walking along and you're starting to find that you're getting too breathless and maybe starting to panic a little bit. In an ideal world, you want to find an object to lean on. Now, in a best case scenario, something like a wall is really good. What you can do is actually put your back against the wall, bend yourself down a little bit, lean yourself forwards, and then just spend a couple of moments doing deep breath in through your nose and out through your mouth. So inhale through your nose, exhale through your mouth. Or alternatively, if you find that's a bit of an awkward position to get into, placing a hand against the wall or both hands against the wall and just leaning in and being able to get a bit more control. The reason this is useful is if you do start to feel faint, what you can do is use the wall to guide yourself safely to the floor to actually prevent a fall. And again, if you had your back against the wall, you would use it as a way to then be able to get yourself down, slide your back against the wall and then sit back in a comfortable position on the floor. Now, if you had the luxury of finding places to sit, for example, a bench, or you're in your house and you can get yourself to your bed or a chair, all you want to do is quite literally perch yourself down. But again, many people find this still gets you too breathless. So you want to lean yourself forwards. And if you can, actually just placing your head down a little bit so your chest is towards the floor. And then you just want to again take deep breaths in through your nose and out through your mouth. By doing the in through your nose and out through your mouth, it's controlling the breath flow so that we're getting a nice bit of oxygen in and getting our carbon dioxide out. So again, in through your nose and out through your mouth. By resting your arms against your knees, again, it's just deactivating some of the muscles so there's less demand on the body. So that's what we do when we've got an object that we can lean against or sit on. However, that's not always the case. If you're in the open and there's nothing to lean against, all you're going to do is much the same. So if you can, slight laxity in the knees, lean yourself forwards and put your weight of your upper body against your thighs. And again, breathe in through your nose, out through your mouth. Again, what this is doing is trying to relax as many muscles as we can so that there's less demand on oxygen. And again, we're trying to open up the upper part of our airways as much as possible so that we can get that good airflow in and the carbon dioxide out. And again, if you start to feel faint, you are already in a direction to safely go down to the floor. And if you are ever panicked, getting onto the floor is a good thing. So don't worry about that so much. It's getting yourself into a position where you can get to the floor safely rather than falling and then risking an injury. The second technique is around what to do in the moment, particularly if you're struggling with anxiety. And there are various ways that you can work on it, but basically it's finding an object to refocus your attention. So in a best case scenario, find something rectangular in a room. So say you're in a medical appointment and you're waiting for a doctor's appointment, you're feeling very anxious, you start to feel breathless, or you are doing activity and you're feeling quite breathless. Say you've gone and done a bit of gardening. What you want to do is find something in your visual field that has a rectangular shape. And that could easily be your hand, or it could be a phone, it could be a TV screen, a poster, anything like that. And what you want to do is breathe in on the short angle, exhale on the long angle. So if you did it with your hand, for example, you're out there doing a bit of gardening or sat in that medical appointment, put your hand out in front of you, inhale for the short angle, exhale for the long angle. Again, in for your nose, out for your mouth. Inhale and exhale. It sounds very simple, but it redirects your focus on breathing with good quality rather than breathing in a panic state where we only use a small proportion of our airways. I personally find doing it with your hand can be really effective because not only are you refocusing your attention, but you're getting sensory feedback from your touch. So it just gives you a little bit more reinforcement of what you're trying to do. So again, you would inhale on the short angle, exhale on the long. And pace yourself with a breath control that suits you. So some people might breathe a bit longer than others. Doesn't matter. When you first start, it might be a bit, but the goal is to slowly extend that breath control to allow things to relax and calm down. The third activity is very similar to the second. It's about refocusing our attention. And this is around not so much visualizing, but visualizing with a smell attachment. And again, it's about reinforcing your focus. So if you're finding the calm hand or finding something rectangular, breathing in and exhaling, not working very well, this might work a little bit more effectively because it's touching into a bit of memory. So it's about smelling a rose and trying to blow out a candle. So visualize and imagine yourself smelling a rose. So it's that soft breathe in to get that scent of a rose, and then exhale like you're trying to blow out a candle. Inhale the rose, so it's soft and gentle, and then blowing out that candle. What this is doing is it's reinforcing that relaxation state, and because it's making us think about things like smelling a rose, it taps into a part of our brain that allows things to switch off and calm down a little bit more easier. And then really the final strategy is just doing an immediate breathing exercise. And if possible, it's best to place your hand somewhere that feels comfortable, whether it's just your stomach and your chest. Doesn't particularly matter, but it's just allowing you to focus on where you should be breathing. I quite like hand on chest and stomach because it helps you recognize that we're trying to breathe in not just to the upper part of the airways, but the lower part of the airways. So say you're sat waiting for something, getting anxious, easy to do, or if you're out and about doing something in the garden or going to the shops and you start to feel breathless, find somewhere to lean against and then do this exercise. So hand on your chest, hand on your stomach. You're going to breathe in for 3 seconds, out for 4 seconds. Now, these seconds may vary person to person, so don't think you need to do 3 and 4 seconds. Work to what you can. When you start, you might only do 2 seconds in, 3 seconds out, but the goal is to gently lengthen that breath control to allow things to relax down. So you've got all panicked, hands on your chest, hand on your stomach. We're just going to inhale through our nose, exhale through our mouth. So inhale, exhale, inhale, exhale. And you would do that 3 to 10 times, but again, get yourself into a comfortable position. If you are really struggling with breathlessness, again, you can do that in that leaned forward position. So when you're resting against a wall, leaning yourself forwards, in for your nose, and exhale. And don't worry if initially it's a bit panicked, your heart rate's pounding. The goal is with each breath, things slow down and start to calm back down again. It won't happen within the first second or two, but might happen within a couple of seconds to even a couple of minutes. So when we're trying to get breathlessness under control in an acute scenario, it's something that you just need to be patient in that moment and allow things to gently relax. Really, the goal is to refocus your attention so that we don't get anxious, we don't get stressed, because that makes us more breathless. So those are the three main strategies. First of all, positioning to make sure that you are safe and to open your airways. Second, to think about refocusing your attention, whether that is doing the calm hand or the rectangle breathing, or the visualization of the smelling of the rose and blowing out the candle. And then step 3 is doing 3 to 10 controlled breaths of breath control. Normally, a combination of all 3 is best, and for most people, you'll find within a couple of minutes, everything starts to steady out, and then you can start to think about resuming activity. So those are the key tips of managing breathlessness. It sounds very simple, but in the moment when we're anxious, we're panicked, and we're struggling to breathe, it can feel like a real minefield, particularly when your heart rate is pounding out of your chest. But trust me, refocusing your attention, getting you into a safe position really does work, particularly after you do this after several rounds. So it's something that you do in the moment, but you do in the moment consecutively when these episodes of breathlessness occur. Hopefully, over time, once we start working on your breathing mechanism, which is going to be in next week's video, you'll find that this happens less often anyway, because we're expanding your airways and improving your lung function. Let me know in the comments below if you've got any questions or if there's any topics you'd like me to cover. And all I can say is I wish you the best of luck with everything, and I hope that these tips are helpful to you.